Hey there, everybody. Recording in progress. That means we're all set. And as you come into the Wondrous Roots classroom, welcome everybody this morning. Well, this afternoon. I always say that, right? Because it's morning and then I get here to do this and it's immediately afternoon. So anyway, welcome everybody. While you're coming on in, I will introduce myself. My name is Becky Montrone. I'm a holistic healthcare practitioner, so I have a degree in holistic nutrition, and I'm also an herbalist. I work with people of all ages, health conditions of all kinds. I kind of consider myself a health detective. So what I don't know, I try to find out as much as I can about that. We have a practice here in Keene called, Wondrous Roots up on the third floor of the Miller Forge building in downtown Keene on Roxbury Street. We're open 9:30 to 5, Monday through Friday. Our number here is 603-439-2603. I have two websites, wondrousroots.org, which is more of an educational website information. I love to make a lot of information available to you, as most of you know who are with me here. And shop wondrousroots.com. So I'm an herbalist and I have a couple of 100 different formulas that are my own herbal formulas. We have a full skincare line. And I also carry supplements by third-party providers that I use, typically things that I use and choose for clients I'm working with, but we make available to the general public as well. So those you can find at shopwondrousroots.com, excuse me. And you can also get easily from one website to the next. So I think that from either of those websites, you can reach out to me, contact us, comes to my private email. I'm the one who sees those messages and I will be the one responding. Okay, I think that's about it by way of introduction. So I wanted to do a program on bone health, osteoporosis, osteopenia. I did one a while back that was titled more along the lines of, are we getting stoned to death with calcium? And it was kind of coming from that perspective. But people are always asking me, excuse me, frog in my throat. I haven't done much talking this morning. I've done a lot of computer work, not much talking. So, yeah, so people are always asking me about bone health and, they're being told they have osteoporosis or osteopenia. They're getting recommended medication from their doctor maybe, or, other advice. So I want to do another official program on that, but I just didn't have time to get that together. I got my outline together last night, but I really didn't have time to develop it as well as I wanted to. And another thing I've been wanting to talk about is urinary tract health. So especially women especially who get repeated urinary tract infections and what I recommend for that. So I decided I'd do a program on that today. That's a lot more simple. And I had done a blog post on it last weekend. So I thought I would just kind of expand on that, and bring it to you. Again, kind of what I've been doing lately is, of course, I get asked, and this is not this is not unexpected, and it's certainly something I don't mind doing, but I get asked constantly the same questions, right? What do I do for my bones? What do I do for my, what do I do? I feel like I'm getting a UTI, that kind of thing. So last weekend I had an email from somebody who reached out to me because a client recommended she reach out to me asking about what to do for UTI. And rather than just answer the email like I do and then answer the next email and put the time into it, I thought, I'm just going to write a blog post, put it out there, and then when people ask me this, I can just zap them the link to my post or my information rather than reinventing the wheel every single time and spending time on it. So that's where I came to this. So I thought it would be good to put it into a webinar presentation, which will be on video. And then I'll also refer you to that blog page, because it has a lot of links and things that are helpful if you want to share it with somebody. This is a problem that's common too. I say a lot of women. Now, men will get urinary tract infections, not nearly as often. One of the reasons for that is the road from the outlet to their bladder is longer because of the penis, whereas in the woman you have, that short road, the urethra, to the bladder, and so it's easier to get bacteria into that area. Men will typically end up with urinary tract infection problems if they have to be catheterized for any length of time. So maybe a man with a prostate issue and his prostate's enlarged and has to be catheterized for a while. Certain other forms of, not E. coli, but there's other bacteria that can kind of love that plastic and make it difficult to get rid of. And so men, today I'm going to be talking more about your typical female UTI. So what did I want to say? Oh yeah. If you want to participate, you can raise your hand. And now I will try to pay attention, Joe. Raise your hand. I'll call on you and we can see you or hear you, whichever you prefer, and we'll talk. Or you can go to the chat and type it in, or you can go to the Q&A and type it in, and I will try to pay attention to those things. All right, so I think that's about it. Plan to do the bone health program next week. I'll start working on that this weekend and get a jump on it. It's really quite involved, and so I want to spend my time. All right, so off we go. I'm going to share my screen. Whoops. I'm going to not share my screen for a second. Just because I want to get me back to my start slide for dramatic effect. Okay. Okay, I think that's done properly. I'll get my chat over here. I'll get my participants so I can keep an eye on you. Whoops. Put you over here. I have a nice big screen, so that's helpful. All right. Okay, natural UTI support, prevention and relief. So what I kind of want to go over today, what is the UTI? Why do we get them? How are they typically treated? What happens when you go to your doctor with a UTI? Can they be prevented? The answer is yes. In many cases, that's the good news. What are some natural tools we can use to prevent before they happen, or treat once they do? If they're still in the mild stage, a lot of times you can get away with not going for prescription treatment. Okay. So urinary tract infections are among the most common bacterial infections affecting millions of people each year, especially women. A UTI can occur anywhere along the urinary tract, but it most commonly affects the bladder, a condition known as cystitis, which is inflammation of the bladder. Cyst, bladder. It's kind of interesting, right? Because you think, well, cyst is a cyst, right? So a cyst, but it's a cyst in the sense that it's shaped like a cyst. So it's a cistern, if you will. The usual culprit is Escherichia coli, E. coli, a type of bacteria that normally resides in the intestines but can easily migrate into the urethra and bladder where it doesn't belong. So that's the whole thing where they tell you to wipe front to back, not back to front, because you don't want to get any bowel movement near the urethra, because that's where the E. coli lives. So you can get a lot of, especially women, again, cross over into that area if you're not careful with your wiping techniques. Typical symptoms of UTI, urinary urgency. So you feel like you have to go, but then you go and you don't really have much to void. Burning or discomfort during urination. A lot of times you'll feel that like sort of towards the end of your void. Burning or discomfort. Yeah. Frequent urination in small amounts, which I just said. Pelvic discomfort. If not addressed promptly, an infection can ascend to the kidneys and cause more serious illness. So that's why you do want to nip it in the bud. Usually starts in the bladder, not in the kidneys, but it can like back up like in the ureters. I'll give you a diagram of that whole part of the anatomy. It's pretty simple. You can see how that can happen. While antibiotics are often prescribed, many people seek natural approaches to support urinary tract health, whether for prevention, recovery, or ongoing resilience, especially in the face of antibiotic resistance and recurrent infections. And again, this is the beautiful thing, because I have women who have had trouble with this problem for years. And if they stay just on their D-mannose, they don't have any more problem. I've had that happen in several cases of especially older women who have vaginal dryness, urethral dryness, which can make you less able to sort of repel that bacterial infection. And so it's really great if you just know what to do and have a few tools on hand, or even use something like regularly every day. Very, very, things that we use regularly every day, right, aren't things that you build resistance up to there. And we'll get to those shortly. So why do they keep coming back? This is the person who gets the recurrent UTIs. Oh no, not again. Got that feeling again. Blah. The adhesion of bacteria to the bladder wall, that's actually what causes the infectious process, is that E. coli actually latches onto the wall of the bladder. Disruption of mucosal immunity. So that mucosal barrier being thinner and not as effective because of dryness, vaginal dryness, postmenopausal. Antibiotics can disrupt that mucosal barrier, the immunity that you would naturally have against that infection. And then you've got the gut, vagina, bladder, microbial connection. So you can have microbiome imbalance, right? So this is where using probiotics can be helpful. And then an incomplete eradication or biofilm protection. So the bacteria can create around themselves what is known as a biofilm that keeps them insulated from treatment. So we'll get a little bit more into that. So you can start with bacteria coming up into the urethra. You end up with a bladder infection, cystitis. And then the bacteria can flow backwards up through the ureters. So this is the urethra, and this is the ureter. And then you can end up with the pyelonephritis. So you can end up pyelonephritis, which is the kidney infection. So bacterial adhesion, how infections take hold. Most UTIs begin when bacteria, usually E. coli, again, cling to the bladder wall. They use tiny sticky fingers called fimbriae or pili to latch onto the urinary lining. Once attached, they resist being flushed out by urine. This gives them time to multiply, cause inflammation, and potentially form biofilms. Adhesion is the first step. If you can block it, you can often prevent infection entirely. That's where we're going to talk about D-mannose in a few minutes, because that's what that does. That's what cranberry does. And it's so interesting. I got through this entire presentation and never even mentioned cranberry. But that's because I did the D-mannose thing, and it's the D-mannose and the cranberry that is effective to help with that. So again, we'll get to that. So anyway, the disruption of your mucosal immunity when defenses break down, the urinary tract lining, the urothelium, is protected by a thin mucosal immune barrier. It contains antibodies, beneficial flora, antimicrobial peptides, and immune cells. Factors like antibiotics, hormone decline again, stress or chronic inflammation can weaken the defense. And once the mucosa is compromised, bacteria can adhere more easily, invade the tissue, and trigger inflammation. Rebuilding mucosal immunity is key to preventing recurrence and chronic irritation. So natural ways to restore mucosal defense, probiotics, especially these certain strains. And I'll show you like a particular, like they make, and you've probably seen them, but they make some probiotics that are specifically for vaginal and bladder health in in women. So they use particular strains like this L. rhamnosus, L. reuteri, L. gasseri. DHEA vaginal suppositories I like to use. They support tissue integrity in postmenopause. So the big thing with postmenopause is you've lost your hormones down there, and so hence you have dryness, vaginal dryness, which is unpleasant in other ways. So you want to have your hormonal support. And DHEA is non-cancer causing. It cascades and converts to some nice estrogen in bioidentical forms, in non-cancer causing form, some testosterone, some progesterone. But a lot of times your doctor might prescribe like an estrogen cream or something like that. But the idea is the same, trying to restore the hormonal balance. So we'll talk a little bit more about that later. You can use herbs, right, that help. Slippery elm and marshmallow and corn silk are what we call mucilaginous herbs, and they help coat that mucosal tissue. So we like those in the intestines, right? We like those in the nasal mucosa and the bronchial tubes and things like that. So you'll also often see those things in like cough formulas, etc. So we're talking about the mucosa. So think of mucosal immunity as your bladder's natural armor. When it's intact, invaders can't get in. So that's an important part of that prevention. Then you have the whole microbial connection. The gut, the vaginal canal, and bladder are closely linked through the microbial ecosystems. Disruption in one area, like your bowels, right? Often from antibiotics, poor diet, or stress can affect the others. Gut dysbiosis can lead to loss of protective lactobacillus species in the vagina. That makes it easier for uropathogens like E. coli to migrate and cause infection. So restoring microbial balance in the gut and vagina helps protect the bladder long term. Everything's connected down there. Supportive strategies, again, probiotics like L. rhamnosus, L. reuteri, L. gasseri, B. longum. Saccharomyces boulardii I love, especially if you're on an antibiotic, because it's a yeast-based, and that means it you can take it right along with your antibiotic if you're on antibiotic therapy, and one will not interfere with the other. Whereas these other probiotics, right, you've got to make sure you take them, you space them in between your antibiotic doses. So it's all connected. Healing the gut helps restore vaginal flora, which protects the bladder. And then biofilm protection. Biofilms are sticky layers bacteria build to shield themselves from antibiotics, herbs, and immune defenses. They're nasty little things, and we see them in a lot of things. We see them in cancer. We see them in Lyme disease and other tick-borne illnesses where we've got these biofilms, and we need to use things to break the biofilm. A lot of times we use things like serrapeptase for that biofilm breakdown, proteolytic enzymes. They're found in chronic UTIs, catheter-associated infections like I was talking about, and more. Microbes inside biofilms can be up to 1,000 times more resistant to treatment because they've got this protective armor around them. Another big disruptor of biofilm is, of many organisms anyway, is monolaurin, lauric acid from coconut oil. Because the molecular structure is the same, identical to the biofilm itself. And so when it encounters it, it dissolves it nicely. And then the bacteria or fungi or virus spills out and dies. So that's really cool. So even if symptoms improve, bacteria hiding in biofilms can reemerge later. So this is why a person can, get treated, be on antibiotics, but the antibiotics don't get all of the infection because the biofilm is protecting it. And now it's still brewing in your system. Breaking the biofilm barrier is key to lasting results. Natural biofilm busters include N-acetylcysteine, which we use as a precursor to glutathione, but we use the NAC form here. Ellagic acid, which comes from like pomegranate and raspberries. We have it in capsule form. I use that as part of my as part of my what do I want to say? HPV, the forerunner of cervical cancer, human papillomavirus. We use ellagic acid for that. Berberines like golden seal, bayberry, and Oregon grapefruit. Berberines we use for other reasons, but it's also a class of herb that is a biofilm buster. Cranberry, PACs, lactoferrin, and enzymes can break those down, and again, monolaurin. So think of it as breaking down the bacteria's protective hideout so your treatment can actually reach them. Your conventional treatment approach, if you have a UTI and you go see your doctor, standard antibiotic protocols. Downsize is a lot of times, especially if you do this often enough, your bacteria will develop resistance against the antibiotics. And so then they don't work, and then they have to use something else. And there's troubling things with some of them too, like some you really want to keep an eye out for and avoid if at all possible. Cipro is a classic UTI drug, although I think they're trying to get away from using that now because they realize it is a ciprofloxacin is a floxy medication that can cause a lot of kind of irreversible symptoms in a person, problems going down the line. So I think doctors are, from what I hear from people, pretty much trying to avoid Cipro. Bactrim is the typical one. Sulfa, it's a sulfa drug. So if you can tolerate sulfa drugs, that's an option. Another one, Keflex, another one, nitrofurantoin. I will tell you, my daughter was on nitrofurantoin, Krista, last year, earlier in the year, like maybe February or whatnot. And she was prescribed nitrofurantoin and ended up with a horrible reaction to that drug, which we were able to trace. I've talked about this before, but I'll talk about it now in this context. We were able to trace to her catecholamine transferase, COMT, blockage and mutation in her methylation genetics, and that effect on dopamine and norepinephrine. Nitrofurantoin has an effect there, and she ended up with a polyneuropathy that she, at one point, we were afraid she had MS. She was so symptomatic. So some of these antibiotics can be nasty. So know your antibiotics. If you know that you're you have problems with certain ones, make sure your doctor knows. So supporting the urinary tract naturally, daily prevention tools. So again, D-mannose, so we'll go into that a little bit. D-mannose, blocking the bacteria before they stick. So D-mannose is a naturally occurring sugar. It's polysaccharide that binds to E. coli fimbriae, the sticky fingers they use to attach to the bladder wall. Once bound, the bacteria are flushed out in the urine before they can stick and multiply. So this is perfect. So this is what I have several women using, and they use it with great success because they do it every day. And that just nips it in the bud, right? Because maybe you get the bacteria up there, but they have no place to go. And the D-mannose comes through in the urine, and it attracts the bacteria to itself, binds to it, and it just flows straight out into the toilet. So it's a great tool. And the one thing I say about that with people is to break your dose up. Like 500 milligrams morning and night is probably adequate as a prevention. You could go more than that if you found you needed it. If you have an infection, you might do 500 milligrams like 4 times a day, but it's better to spread it out because you take it into your bloodstream and your body can only utilize so much at a time. And if you get more than you need, it'll loosen your stools. It won't harm you, but it'll give you diarrhea. So if you're using D-mannose and it's giving you diarrhea, it's because you're taking too much at one time. I mean, a lot of doses on the bottle will tell you 2,000 milligrams twice a day or something like that. So if you can tolerate that and you need that much, fine, but I'm just saying it's better. And I think 500 milligrams in a day, 500 milligrams twice a day for most people would be probably adequate to keep that from happening. To keep the bladder infection from happening is what I'm saying. And it certainly won't cause diarrhea. So Monarda fistulosa, I talked about that. I did a whole program out of Matthew Wood's book, The Book of Herbal Wisdom, a while back. And if you're interested in seeing that, it's on my YouTube and Rumble channels, but that video. But anyway, this is more anecdotal, right, than science, but has been found to be quite effective. So traditionally used as a urinary tract tonic and energetic protector, especially in low dose applications. So that again is that one that I tell you to put 3 drops on your tongue 3 times a day, not more. But do it every day, 3 times a day. That can be the hard thing, right? Because it's easy to think to do stuff like morning and night, I find, but oh, did I take my 3rd dose of Monarda? But I have had women tell me this really works well for them. So in any case, you can always just think about doing that. It's also got some really nice other effects for you. It's known to like draw fire. Appears to help moderate urinary terrain, even when bacteria aren't present. So he mentioned that. And he also mentioned in that chapter of his book about how he had a woman, a colleague in Massachusetts, who uses this with such success that the urology department at the local hospital had asked her about it. So yeah, it's definitely worth trying. Super inexpensive, right? Because you just 3 drops a day. So like a $12 1 ounce bottle will last you forever. And then we have some other things like my Wondrous Roots urinary tract health formula. So just kind of, and you don't have to use my formula, but these are the kinds of herbs you're looking for when it comes to urinary tract health. So you can kind of see it easier here. Agrimony, I blended this together, so it's kind of doing a number of things, like it's helping with the pain. Some of the things that we look at for that are like the slippery elm bark, which is the mucilaginous soothing, coats the inflamed tissues. What else does that? The astringent and toning to the mucous membranes, the agrimony. Then you have the boohoo leaf, a traditional urinary antiseptic, so that you're doing to kill the bacteria, supports healthy bladder and kidney function. Pipsissewa herb, I don't know, that just seems like such an appropriate name for something that has to do with PISS, right? Pipsissewa herb. Lymphatic stimulant and urinary antiseptic, so again, antibacterial. They are useful in sluggish or congested urinary conditions. Dandelion leaf, it helps you increase the urinary flow and supports kidney function. So one thing you want to be doing if you have a UTI, right, is drink plenty of water and keep it moving, because you want to flush out through the urethra. Uva urzi is a very active antibacterial natural antibiotic for UTI. So it is converts to hydroquinone in the urine to combat pathogens. Red leaf clover and blossom, lymph cleansing, mildly estrogenic, supports tissue repair, gentle detox. Cleavers is a soothing diuretic and lymphatic herb, promotes healthy urinary flow, glandular drainage. Juniper berry, antimicrobial and diuretic, supports the clearance of urinary tract irritants. Parsley leaf, a gentle diuretic rich in chlorophyll and potassium, supports urinary flow and freshens the system. And then again, the slippery elm bark, which is mucilaginous, soothing to those tissues. A lot of times what they'll do, or you can do now over the counter, is you can take Pyridium as a medication, Pyridium as in azo. over the counter now is makes your urine really orange. That can be really helpful if you're in pain, because that bladder infection pain is really bad. It's kind of intolerable if you've not experienced it. If you have experienced, you'll know what I'm talking about. And then we also have a tea that I formulated here with the juniper berry, again, nettle leaf, horsetail, which is rich in silica, so that tones the bladder tissue and strengthens connective tissue in the urinary tract, corn silk, soothing to inflamed or irritated urinary tissues, classical or herbal support, corn silk for bladder comfort. Honeybush tea, mildly sweet and antioxidant rich, adds a pleasant flavor while supporting overall well-being. Dandelion leaf again, Pipsissewa, there we go again, and Uva urzi. We just kind of went through those. So that's the kind of thing too, if you like tea and you're disciplined to take a tea or a tincture as a preventive, but they're also really good. Pick up the dosing if you're fighting something. And then this is really fascinating. So Krista told me about this. Our daughter told me. She said, Mom, she's like, you could make a fortune if you advertised this for UTI prevention. So this is the Wondrous Healthy Skin Spray. This is hypochlorous acid. And I talked about this last year when I first found out about it for the skin, right? For rosacea, for acne, for blepharitis, for eczema, psoriasis, you name it. It's like really wonderful. It sounds like, oh no, it's an acid, but hypochlorous acid is the body's natural bleach. It's a bleach that we make ourselves. And it's just really cool that it's as effective as it is, but it has been shown and demonstrated. Like, I'm sure if I go here, hypochlorous acid for UTI tract prevention. It looks like I've looked for that before. UTI spray, you can see people using that. They're using it as a thing, but I wanted to see wanted to actually find like a prevention effect of hypochlorous acid flushing solution. So we had, anyway, it's very effective against the E. coli. And so something that you want to, you can just spray this, get out of the shower and spray this on your genitalia area. Also, if you're after using the bathroom or something like that, if you tend to be a person to get these things easily, that's like a really easy thing to do. And it sounds like, oh my goodness, acid, is that going to burn or sting? No, absolutely not. Acid doesn't mean burn. So some acids burn, this one doesn't, just like hyaluronic acid, right? Or glycolic acid that you put on your face. Okay, so yeah. It's a naturally occurring compound produced by your immune system. When used as a gentle topical spray, it helps neutralize microbes like E. coli on the skin without disrupting healthy tissue, especially helpful for external use on the genital area after toileting, sexual activity, or travel. Shown in research to reduce the risk of bacterial migration into the urethra. So right there, a barrier. And again, when my PDF is up, this should take you to that product. Yeah. And there I talk a lot more about it. Anyway. So I talked a little earlier about the hormonal support that's super important. So if you start using DHEA well before you're menopausal, you will not even have vaginal urethral dryness. But even after the fact, you can introduce, especially as a vaginal suppository, so that you're really getting the moisture built up nicely down in those areas. What you do for the vagina will cross over into the urethra and moisten the urethra as well, which is very convenient. This is what I recommend to people, the vaginal suppositories, which is really good for your health anyway. after menopause or even during perimenopause or even well before. We start to make less DHEA around age 30. So I started using DHEA in my early 30s. And this can make tissue, the thinning of the vaginal and urethral mucosa makes the tissue more fragile, less acidic, more susceptible to infections and microtrauma. So topical DHEA as a vaginal suppository helps rebuild healthy, resilient mucosa and supports the return of the protective lactobacillus flora. So it helps also with your microbiome. Helps prevent recurrent UTIs, especially in postmenopausal women. I've seen it work really well in postmenopausal incontinence, bladder incontinence. Certainly not in every case, but definitely in a couple of very key cases and very quickly. Okay. Supports tissue integrity, lubrication, microbial balance, often more effective and better tolerated than topical estrogen. And if you get a topical estrogen from your doctor, then you have to think about its synthetic form and cancer risk, whereas you can use estriol. Bezvekin makes one that's just estriol. It makes one that's estriol, DHEA, and progesterone. Low dose estriol. So if you want something with more hormones in it, but again, I think the DHEA is adequate because we convert some of that to estrogen. Okay, and then again, delving a little bit more into microbiome balance, protecting the urinary tract from the inside out. A healthy balance of beneficial bacteria in the gut, vagina, and bladder is essential for preventing infections. Lactobacillus species help maintain an acidic environment, compete with pathogens, and block bacterial adhesion. Antibiotics, stress, aging, poor diet can disrupt the balance, allowing opportunistic microbes like E. coli to thrive. Probiotic supplementation helps restore key species, especially after antibiotics or recurrent UTI patterns. So you're looking for these strains. I did find this particular one, which I started to stock just this past week because I didn't have anything like that on my shelves. So this is the Therabiotic by Claire Labs, which is designed for that purpose, right? So if you have, if this is a problem for you or whatever, this would be a good choice for you probably as a probiotic. And then again, this one, take at least 2 hours apart from any antibiotics. Again, this is not the Saccharomyces boulardii that doesn't interfere. So you could take that while you're on the antibiotic, or you could use both. But this would be a good preventive, right? Probably especially if you've got gut microbiome issues in the first place. So, because that could be all overlapping. Everything's so connected down there. Yeah, so I just talked about that. So if say you've got you feel like that you're beyond the preventive stage, you're like, yeah, I tend to get these often, so I'm going to do something like that. I'm going to do like a probiotic and some D-mannose every day. See if I can go a year here without getting anything. Maybe use some healthy skin spray, hypochlorous acid. Great, wonderful. I don't get it if you're postmenopausal or you have vaginal dryness for whatever reason. Then maybe that hormones as a daily preventive, right? But now here you are, somebody walks in and says to me, oh, I feel like I'm getting a UTI. And this happens a lot. So grapefruit seed extract is a natural antibiotic. So I want to get into that. So again, you can increase your frequency of D-mannose. We're going to talk about grapefruit seed extract now. If you were using these other things, you can always add those up. But usually I don't send people out with 10 things. I usually send people out with 3 things. And I'll tell you what those are in a second. But I want to go into the grapefruit seed extract because this is really cool. Grapefruit seed extract has been shown to be effective against antibiotic resistant UTI. So You've got a UTI that is a bacteria that has built up and it doesn't respond to your antibiotics because it's built up this resistance. And so grapefruit seed extract of all things. And I read this years ago in, let's go to PubMed though, see if I can find it there. I read it in greenmedinfo.com. But they always cite studies, and usually those go back to PubMed. So grapefruit seed extract, antibiotic resistant UTI. Let's see if we can find something. Retrieved 0 results, so call me a liar. All right, so let's see if we can find it on GreenMedInfo. I promise you I wasn't dreaming. Let's try this. GreenMedInfo. Grapefruit seed extract, UTI. There we go. Yeah, there it is. Now, I promise you, this is going to be found in a database somewhere. Okay. Anyway, urinary tract conventional antibiotics are notorious for killing both the good and the bad bacteria within the body, as well as leading to overgrowth of fungi like Candida albicans, which can lead to yeast infections. Moreover, even when conventional antibiotics suppress acute symptoms of infection, they can drive the survival of even more virulent antibiotic-resistant bacteria. These surviving colonies form biofilm, enabling them to lay dormant and grow back with even greater virulence when the infection recurs post-treatment. A remarkable case study published in the Journal of Alternative and Complementary Medicine. Okay, yeah, not in PubMed database. In 2005, titled The Effectiveness of Grapefruit Seeds in Treating Urinary Tract Infections, found that the seeds of the grapefruit were highly effective in killing antibiotic-resistant UTIs. So you can see there, even, yeah. So not a bad thing to do. So that's what I will typically recommend for if somebody says, yeah, I have one brewing, then I'm like, let's get in a natural antibiotic right away, right? So hopefully you can avoid having to go to the doctor and get on a prescription antibiotic. So we have the Da Vinci Labs grapefruit seed extract, which I typically dose 400 milligrams twice a day. I can't remember if it's 2 or 3 times a day, but whatever it says on that bottle. But again, you only use that, you don't use that as a preventive, right? Like you're not going to be on an antibiotic. Like I know they sometimes do that for people who get recurrent infections. They put you on low dose minocycline or something like that, but you don't want to do that. You don't want to use grapefruit seed extract every day. You want to use it if you have an infection like a medication. So use, for up to 2 weeks, and use, probiotic along with it, like the ones we were just talking about, or the Saccharomyces boulardii. So that's what I say. This is my most typical recommendations when somebody comes in and says, I feel like I might be getting a UTI. I usually send them out with these 3 things. It's just kind of like, here you're getting anti-infective stuff in the urinary tract formula. You're getting, antibacterial stuff, but you're also getting comfort, the support there. And then the grapefruit seed extract as your natural antibiotic, and then the D-mannose to keep that E. coli from adhering to the bladder wall. So anyway, that's the way I do that. So anyway, in summary, urinary tract infections may be common, but they're not inevitable. They certainly don't have to run your show. You can feel so vulnerable, like, oh no, I hope this doesn't happen and I have no control over it, right? That's a terrible feeling. So with the right combination of smart daily habits and time-tested natural UTI support allies, you can reclaim the upper hand and stop playing defense against every twinge, urge, or oops, not again. Whether you're preventing your first UTI or finally putting an end to the revolving door of recurrences, remember, your bladder doesn't have to be a victim of bad luck. As I always say, you have so much more power. We have so much more power than we know. So I do also have, and when I put the email out saying that the video is available from this webinar today, I will include this blog link, which you can find right on my website anyway. But let's see if I can get to it. Yeah. So you can see there, I kind of run through this similar information. And in this blog post, I kind of tell you how to, I give you links to everything too. These products are on my website, but you can find them elsewhere if you prefer. The powder, if you prefer the powder over the capsules. But I tell you how to dose it, Monarda fistulosa tincture again. And then you can actually see this is my video that I did on Monarda back in, what does it say, about 1 year ago. So I read Matthew Wood's entire chapter on Monarda fistulosa there. So if you want to see that. This is the tincture, the tea, the healthy skin spray, the DHEA suppositories, probiotic support. And then I have a guideline during active infection, how to do that, how to dose. I said twice daily on that 400 milligram. I'm sure I checked that out. Waterworks tea, mix and match. And again, my typical recommendations. And again, should always, while natural support can be incredibly effective, it's important to seek medical attention if you experience flank pain, fever, blood in the urine, persistent symptoms. You don't want to end up with a full-blown kidney infection, right? So don't be, a word to the wise. While it's really always nice to, use natural remedies. We don't want to be foolish and not use medicine when we need to. So, but a lot of times, if you can get on top of it, or if you can get on top of preventing so nicely, then you don't need to. So that's all I really have to say about that. There was something I wanted to say about something I have been talking about recently, but I can't remember now what it was about. So I guess I can't do that. So I would just say, if nobody has any questions or anything, you get out of class early today. And hopefully you'll enjoy. We've got beautiful weather here in Keene, New Hampshire. So a lot of you are in different places. I recognize who you are and where you are. But hopefully you're also having a wonderful fall day. It is just gorgeous out there. And again, I'll be back next week. I want to talk about the bones and what we can do to keep our bones from getting weak. I'll talk a little bit about why you do want some lessening of bone density as you get older. So the World Health Organization took the kind of, can you get a UTI from the water? Connie is asking. Every time I go to Florida, I get a UTIs, and we are told the water is very bad. Well, if the water has E. coli in it, I suppose. So I don't know. I've not really seen that. Let me do a little search here. Hang on. Well, I've got everybody here. Waterborne urinary tract infections. Have we overlooked an important source of exposure? This is actually, I should share my screen again. Let me share that. And chat and participants. Have we overlooked an important source of exposure? The presence of intestinal pathogenic E. coli in drinking water is well recognized as a risk for diarrhea. The role of drinking water in extraintestinal infections caused by E. coli, such as UTIs, remains poorly understood. Urinary tract infections are a leading cause of outpatient infections globally with a lifetime incidence of 50 to 60% in adult women. We reviewed the scientific literature on the occurrence of uropathogenic E. coli in water supplies to determine whether the waterborne route may be an important overlooked source of UPEC. A limited number of studies have assessed, but no studies have measured, given the prevalence of drinking water supplies contaminated, blah, 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 blah. So then they go into it. They don't really seem to, It looks definitely possible. Definitely possible. Very interesting. Yeah, so be careful when you go to Florida, Connie. Maybe that's a good time for you to use the shungite. The shungite stones would definitely take care of that. Like get your containers and get the shungite stone. If you haven't seen my presentation on that, go to my YouTube channel and look up shungite. And I tell all about how to do that. And it might be a wise thing to do. The extra cleaning of the shungite of your drinking water. Or what I would also say is yeah, I wonder if that also would be like if you're taking a shower or a bath, right? I mean, that would kind of make sense too. So, that's a good point. I'll have to look more into that. But yeah, at least for the drinking water, or buy bottled water. Okay. Anybody else with a question or a comment or anything like that? Anyway, bones. We're going to be talking about bones next time. Them dry bones or weak bones or porous bones or anyway, less dense bones and what to do to protect our bones. And oh, whoops. Good question. I go into a hot tub in an over 50-year-old community, a lot of bleach in the water. So I would think that the bleach would be helpful. The chlorine would be helpful for blocking that. But yeah, I know sometimes it's so mysterious, right? It's so mysterious because you're really not sure where you may have picked this up. But I think it's well worth observing. Like if you're a person who you get these more when you go to Florida, and that's what you've been told about the water, then it's worth paying attention to and taking precautions. All right. Well, with that said, I thank you all for being here. Again, have a wonderful weekend. And we'll be back with Wondrous Roots, Your Health from the Ground Up next week, talking about bones.